poop transplant horror stories. I'm not talking about a movie at your local cinema theater. I'm talking about fecal microbial transplants, poop transplants done by doctors. There was actually 2 people that got a serious life-threatening gastrointestinal infection from E. coli. One of the people died from the donor's the particular treatment that was given is that we have to understand that it may be identifiable only after the fact. Do it yourself medical condition that's serious, you're desperate for a treatment, and you'll just about do anything. So if you have a gastroenterologist that's ready to just go ahead and do this treatment, you could be in for a big surprise. Remember the whoops factor. Now, another thing to consider is that people that have gotten these fecal transplants, there are animal studies as well as human studies that have found that you can take on the characteristics of the donor from the transplant. So you can end up with weight gain, or you can end up with depression or anxiety, or any number of other things, mood disorders of different sorts. So beware, be careful. Remember there's alternatives, and I'm going to be talking about that in our next time that I'm on here, which will be Friday. I'll be sharing with you some alternatives that are much safer and very effective treatments that you don't have to go this route with the fecal microbial transplants. Basically, I'm going to give you some very safe recommendations that you can use. And these are personal experiences I've had with patients of mine who've had dramatic results with getting over C. difficile when they've even had the problem reoccur medically 3 or 4 times, given them antibiotics. They didn't treat it, didn't work. And after we instituted our natural protocols, they were able to help the patient get over it and never came back. So I want you to make sure that you take a look at all alternatives. And I'm going to give you, again, the quick review. We talked today about fecal microbial transplants, abbreviated FMT. This condition, or this treatment now, is being used for conditions like C. difficile, irritable bowel syndrome, chronic fatigue. The medical community is looking at it for mood disorders, for psychiatric disorders. And so even cancer and diabetes is being looked at. So remember now, we've talked about for the longest time that death begins in the colon. How you go about treating the colon problems, how you go about reestablishing the good, healthy microbiome is a critical factor. We'll be talking about the alternatives on the next time that I make a post on Friday. So tell your family and friends about it. Until next time, I am Dr. Krystosik. You can call me Dr. Good Carbs. Leave a comment below, and also give me any questions you might have about this subject, and I'll be happy to answer it for you. And don't forget to subscribe to my channel. Until next time, here's to your health.